Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a June 3rd, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. I'm not able to give any updates on COVID-19 cases and recoveries, etc. today. The Iowa Department of Public Health is having technical difficulties with their data collection and their website portal. So no news on cases today. But we've been talking a lot about planning for the summer, the fall, and the future in general as we make our way through this COVID-19 pandemic. Working for a city government my entire career, I know that we can learn quite a bit from city planners and engineers who design and plan our streets, water and sewer infrastructure, flood prevention systems, traffic flow, and many other things. A concept engineers and planners have been wrestling with in recent years is called stationarity. I read an article in Vice News that describes stationarity as the idea that statistically, the past can help you predict and plan for the future, that the variations in climate, water flow, temperature, and storm severity have remained and will remain stationary or constant. Our engineers have used 10 or 100 or 500-year flood models and statistics to plan for sewers, streets, and stormwater flooding for years. With all the changes in our climate, those models have been updated. But are they enough to rely on? Dubuque experienced multiple events of 100-year flooding in less than a decade. So anything that was built in the past on those old models and predictions is clearly not adequate. Enter the new concept of non-stationarity, which means that we live in a world where there is no such thing as normal, where every new year comes rife with uncertainty and the threat of extremes we've never seen before. So how do we plan for the future when we may have to accept that the future won't look like the past? And how does this apply to the COVID-19 pandemic? The healthcare industry and public health infrastructure has only handled extremes it has experienced in the past, and we've learned from those. And every time there's a new disease, whether it's Ebola, Zika, resistant tuberculosis, West Nile, mad cow, or whatever, healthcare reacts and treats it, and public health has added expectations for prevention and follow-up. It's not easy to adapt in this reactionary way with stationarity as our planning tool. Healthcare and public health, along with the rest of the economy and the community, has adapted to dealing with COVID-19, but not without huge financial and societal costs. And it's going to take a lot of sacrifices and efforts on all of our parts to keep the spread of COVID-19 at a low rate. We are slowly adapting to a system of resiliency, being able to prevent, prepare, and adapt from adverse events. So as we're looking at day-to-day numbers of new COVID-19 cases, keep in mind the big picture, and the collective results of all of our efforts and planning will definitely affect how we come through this pandemic as individuals and as a community. Speaking of community, the City of Dubuque's parks have been open, but now additional amenities and facilities will be added. Marie Ware, Leisure Services Manager, stated, "Our parks, green spaces, and recreational spaces matter now more than ever. Our decisions have been guided by state and national public health guidelines and best practices, and will continue to be. But we need our residents to practice personal responsibility for us to do this work. We must work together and follow the rules to keep these spaces open." Our local public health has met and planned with our parks departments on all of these things also. So as tennis, pickleball, and horseshoe courts open, along with some picnic tables in the pet park, keep in mind that we will still have 50% capacity limitations and other public health restrictions. Here's some tips for using the park this summer. Bring your own water bottle, hand sanitizer, and/or hand sanitizing wipes. Bring a table cover if you plan to use a picnic table. Bring a mask in case you cannot social distance. Go to the restroom before leaving your house, since restrooms will not be open. If an area is very busy or those present are not practicing social distancing, change your plans or choose another location. And most importantly, don't go out if you are sick or have any symptoms of COVID-19. Visiting our parks is a great way to stay active, clear our heads, and get some socialization when we all need it the most. The parks are not perfect, and limited park department staff is working hard to keep the parks usable for all. So please be patient as we reopen our parks and green spaces. These guidelines also apply to our county campgrounds and open spaces as they begin to reopen. Finally, as we try to plan for resiliency, including returning to our routines or our new routines as we create them, reflect on the words of Elizabeth Edwards. Resilience is accepting your new reality, even if it is less good than the one you had before. You can fight it, you can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. Thanks for tuning in today. Let's all continue to be safe, be smart, when in doubt, don't go out, and remember, we're all in this together.